Having experienced heart issues in the past, checking his Apple Watch first thing in the morning was routine for Jason. But something about this particular morning was different.
I looked over at my watch and I saw something I had never seen before, and that was the atrial fibrillation monitor going off. And one of my coworkers looked over at me. He said, Jason, are you okay? You're pale. You don't look like yourself. I think you need to get to the hospital. When I was walking to my car in a garage, I was having trouble breathing. And I kept looking at my watch, and I noticed that my heart rate was just skyrocketing. It almost felt like I was having a panic attack. They immediately took me into the emergency room, got me on a bed, and said I was going into cardiac arrest. That's when it hit me the hardest. One of the cardiologists told me what atrial fibrillation was and how serious it actually is. What I didn't realize, which scared me to death, was it's the number one cause of strokes. They decided to do a cardiac ablation to fix the AFib. I had just had my 6-month checkup on Monday with my cardiologist, and I showed him some past EKG readings from my Apple Watch. I can literally just send those right to him. There will not be a day that goes by that I don't have something on my wrist that will monitor my heart. If I hadn't had that, I wouldn't have known to go to the hospital.
From wearable devices like the Apple Watch to virtual doctor visits, mobile health apps, and on-demand pharmaceuticals, new advances in healthcare technology stand to provide more access to more patients, giving them new options, insight, and control over their overall health. But what are the options? And where can patients begin? Hi, I'm Dr. Neha Pathak, Chief Physician Editor for Health and Lifestyle Medicine at WebMD. Welcome to a very special episode of Health Discovered on healthcare technology.
Amazon One Medical presents Painful Thoughts.
I could catch anything sitting in this doctor's waiting room. Ugh, a kid just wiped his runny nose on my jacket. And the guy next to me, sitting in a pool of perspiration, insists on sharing my armrest. Ugh.
Next time, make an appointment with an Amazon One Medical provider. There's no waiting and no sweaty guy. Amazon One Medical. Healthcare just got less painful.
Can you hear me?
I can.
Oh, good. Mm-hmm. Good. So we're just going to jump right to get a better understanding of the current health tech landscape. I wanted to talk to Dr. Aditi Joshi.
I've been in telemedicine for now 11 years. We saw the pandemic, we saw the growth of telemedicine. And through those experiences, I realized that there was a lot that people didn't realize about telehealth, its benefits, how it could be used, and then really, how do you build the best program out so that we can take the technology that we have and really benefit patients.
In addition to her extensive background in healthcare, Aditi has personally served over 25,000 patients on telemedicine and turned her experiences with healthcare technology into a book called Telehealth Success: How to Thrive in the New Age of Remote Care. So before we jump into my questions about telehealth, I'd love to start by just taking a step back and ask you to define telehealth.
Just by definition, telemedicine is using technology to connect two parties to have a medical encounter. And so using that definition, you can take telepharmacy, tele-urgent care, tele-ICU, all of that counts under it.
Okay, that's really helpful. Clearly, there were pockets of telehealth use before the pandemic, but a boom during COVID-19 and after. So where are you seeing this boom when you're thinking about that broad landscape of what telehealth means to different patients?
So for patients, we are seeing most of them are using it for mental health. considering that there aren't enough mental health practitioners, psychiatrists, therapists. And so people can now connect with someone regardless of geography. And also, there's less of a barrier. There isn't necessarily a physical examination required. There's a lot of other types of companies popping up, and they're really based on what patients are asking for. They're asking for convenient care. So we see a lot of people using urgent care, seeing pediatrics. We also see them for some of these newer types of companies coming out that are direct to consumer for anti-aging, obesity, medicine. So it's really based on what patients want in that degree.
So you say it's what patients are asking for. What patient groups are you finding are really engaging with telehealth and are finding a lot of benefit?
You'll see a couple of groups. People who are living in rural areas, mainly because it was paid for and offered to them much earlier than it was offered to the rest of us who may live in urban areas, suburban areas. Groups that are, generally stigmatized or feel that they can't go into a clinic. And this can be a whole host of different types of complaints or patients. It can be those who are needing mental health services. It could be LGBTQ plus community. There's a lot of them who don't feel maybe safe going to a clinic. So anything that can be also stigmatized, either disease or in population, you'll see a lot of that being used as well. We're also seeing a lot of women that use it. So if you look at the numbers, there's still more women using telemedicine than anybody else.
You're seeing that women are using it more. And I think that really resonates with me as a mom in a multi-generational household. So I've done these virtual appointments for my 86-year-old father, my 10-year-old daughter, myself on occasion. So tell me a little bit more about what you're seeing with regard to the needs that are being met for women specifically.
So if you look at all of the research out there, women still tend to take care of the health needs of the entire household. And now that we're in this sandwich generation where women and, families are taking care of children as well as their elderly relatives, that is a whole host of people that people need to take care of. So telemedicine helps in a lot of ways. For one, the way that you were stating it, you can actually have your elderly parents or family members be seen over telemedicine from home, so you don't need to take them in, because taking them into the hospital may mean childcare, or it may mean taking your kids with you. And I'll tell you, nobody wants to bring their children to a clinic or an emergency department. Obviously, it's a barrier and it's a lot of work. So this takes away some of that. So going back to what that research shows is that women are not getting their own needs met, their own healthcare needs met, because they're caretaking for so many people. And so they're putting their needs to the back. There's a lot that could be said about this topic as a whole, but with telemedicine, women are getting healthcare. They're getting mental health care. They're getting primary health care. They're able to actually get seen for their needs as well, because they can do it from home. They can take 15 minutes or 30 minutes or whatever it is, and they're able to get healthcare too.
Everything you say completely resonates with my own experience. Something I'm really curious about is your thoughts on telepharmacy and what are the available options? How does that work? What problem do you see that solving as well?
Pharmacists are probably underutilized as healthcare workers in our healthcare system. So I'm an emergency medicine physician, and a lot of the emergency departments I've worked in, we had a pharmacist that would work alongside us, and they were incredibly helpful. So now we're taking them and we're saying, all right, well, what can they do with those skills from a virtual capacity? And I think we're going to be seeing that they're able to, one, make sure that people are maybe on the right meds. I think there is also an incredible need for making sure that people understand the meds they're taking, or they're at home and there's maybe something that is unclear to them, or they feel like they might have two medications that don't work well, or just in general, they can be a consultant on the side as part of a collaborative team that works together over telemedicine visits.
So I'm just sort of interested in learning more about what we have with regards to having medications delivered directly. Not to make this all about me, but I keep getting these text messages from my father where it's like, okay, your medication is ready to pick up. And I still haven't found time to stop by the pharmacy. Now, he has pills. I ask him every night, so I promise I'm not being delinquent there. But I'm just curious, in terms of your experience, how are patients finding the benefits of this type of service?
So your example is a great one, right? You're not trying to not pick up the medications. It's just life it can be chaotic. And it's another thing to take off your list. We're seeing that it is actually a really useful thing for patients, but you need a pharmacy that provides this service. And there are places that it's harder to do. What I've seen and what I think is an interesting model that some of these larger non-healthcare tech companies are doing is that they're offering it as a service. So if you're using like CVS or Walmart, they might be leveraging their shared car networks to be able to deliver this, right? And I think that would be a really great connection to be able to use that in the future. My friend, what she would do, and this is, of course, something outside of it, but this is the example I'm thinking of, is that, she will ask somebody to throw the medications in an Uber and she'll pick it up outside her house.
What do you wish that patients knew about that they could take sort of advantage of that patients aren't really aware of or potentially not leveraging as much as they could?
So when telemedicine started, most patients didn't really care who the doctor was or where the care came from because it was convenient and it was new and they could get online and get a prescription refill or get seen for whatever complaint. They just wanted to be seen. Well, since the pandemic, we're seeing a shift in what patients want. Generally, they want more of their own doctors who are offering it, maybe people in their community who are also offering it so that they can see the specialists in their community, which actually goes in line with your question. So what health systems are offering and what they have been doing is actually connecting telehealth doctors or doctors in general to specialists in other places. So if you're a patient, especially one who may have complex medical needs or chronic disease, or, God forbid, you find out you have a cancer and you're not near a place or a hospital that has these higher level care, it is overwhelming to think that you might have to travel hours to go somewhere. The thing is, you don't have to do that. Many health systems, what they will do is you may have to go to those centers here and there, but they will offer telehealth visits in between where you can either get home or they can connect to the hospital near you so you can be seen closer. A really great example of this, which is not necessarily at home, but telestroke or seeing stroke patients in rural or hospitals that don't have neurologists or neurosurgeons has been one of the oldest use cases. And we've found that patients can get seen from a neurosurgeon or a neurologist at a higher specialty care hospital while they're at their local hospital, and then they can be told whether they need to be transferred and what kind of care can be delivered. What's great about this statistic is that 99% of stroke patients in the U.S. are seen within 30 minutes by a stroke neurologist because of telehealth. And so if you're somewhere and you're a patient that needs higher level care, you don't have to always worry and stress where you're going to get it. These are available. So this could be another access point, not just at home.
So at the beginning of this episode, we heard from Jason. His Apple Watch alerted him to an abnormal heart rhythm. So he sought care even before he knew what atrial fibrillation was. With that in mind, I'd love to dive into remote patient monitoring, which is another thing that I think people often think about when they think about telehealth or communicating with the health system. Wearables, other sorts of devices that a health system might give you. Can you talk a little bit about those possibilities and how someone might think about using those devices?
So remote patient monitoring, or RPM for short, is for me just a step forward of telehealth. Let's say you're a patient with diabetes or high blood pressure. Going into your doctor's office to get a reading every 3 months is just not effective, especially for those, they have their blood glucose monitors at home. They're watching their sugars, or if you have a blood pressure machine at home. What RPM does is that it takes these devices and it can seamlessly, using a Bluetooth, putting into an app so your readings are in there, or it could just give you the readings daily and you can put it in there manually. What this is great for is a couple of things. One, if you're finding that your sugars are creeping up, you can contact your doctor, or your doctor can see it in the app and say, okay, let's make sure that this doesn't worsen, that you don't have to end up in the hospital. Let's figure out what we can do. Or they can intervene and say, okay, something's going on. Maybe you have an infection that's making this worse. Let's figure out what's causing this. But basically, it gives more information and it helps all patients so they can avoid some of the negative consequences from some of these chronic diseases. And then two, and most importantly, it gives patients a lot more information about their own health because they could see it every day. They can say, oh, my sugars were at this level today. I did not feel very well. I also realized I didn't really sleep well last night. Maybe that's a correlation. And it gives them so much more power over their own health, which is really the goal because, as physicians, clinicians, we're not with our patients 24/7. It's their health and they really want to improve it. And I think RPM is a great way to do this.
This is something where I've evolved as a clinician or a primary care physician, where I've thought of RPM, remote patient monitoring, really as the most beneficial for patients that already have a chronic condition. I'm starting to think about it more, and I'm curious about your thoughts in the realm of prevention. So for people that aren't diagnosed with anything, people that are generally considered healthy, how are you thinking about what we have to offer currently for those patients?
A lot of our devices, our phones, our watches are doing some of this already. And obviously, people are also investing in some of these devices. If you exercise on your activity every day on your iPhone, for example, it'll talk about heart rate variability. And it can kind of tell you what's your fitness and where should you be at your age. And I can take a look and say, okay, maybe these last few months I was not sleeping as well, or I wasn't working out as much, or I wasn't as physically active. And this might be affecting me. And I know that it's correlated with heart health in the future. And so I'll take a look and say, okay, well, let me make sure this doesn't happen. And it goes further than that. There are people who are monitoring their sugars at home to try to check that, especially if they're worried about diabetes or they're pre-diabetic. You can do this with your weight, your blood pressure, all of these things that have issues of the future. We can use some of these devices to do that. And two, when we gather this data and then we track it for 20 years, we can say, oh, look at this. People in this geography who are doing this, who are at this heart rate, this affected them getting diabetes or high blood pressure, other things correlated with physical activity, for example. And then we can use that and say, hey, let's intervene earlier. We have better data now. And so we'll be able to affect the health of everybody.
We'll be back with more from Dr. Joshi. But before the break, I wanted to share a snippet of a conversation I had with João Bocas, a digital health entrepreneur and CEO of Digital Salutum, for his thoughts on the state of healthcare technology.
There are many technologies with facial recognition, tackling and diagnosing vital health signs, all on a mobile phone. There are apps that give you reminders about tracking your fitness, taking your medication, smoking cessation. These technologies can be extremely beneficial for all age segments, but for also the senior population that have a condition to track and a long-term condition to monitor. Mobile health can bring a lot of value to displaced populations, rural areas, and health apps can offer easy access and valuable information and resources. For example, MediSave for medication, reminders, and MyFitnessPal can track your fitness and even your nutrition. One of the things that is always missing is that piece of health education. So mobile health apps can be very beneficial, but we need the right level of awareness, but also education. Wearables like the Apple Watch play a very crucial role in terms of managing disease, giving people meaningful insights and concrete information about their condition or a potential condition that they are developing. And I think that is very important for the individual, also for the clinicians, to have concrete data that we want to transform in information into value and a better outcome for all. But we need a follow-on from the event. We need something that says, actually, this person is in danger. We make a call for an emergency service or a clinician to get in touch, or for the family member to assist. I have this big vision that the wearables can change the world, but certainly the healthcare world. because of the cost of healthcare, because of accessibility, that all is down to individual. So I'd like to think that self-care is the healthcare of the future, and certainly wearables can play a big part in there if we bring them with a sense of personal responsibility.
Health Discovered will be right back.
Amazon Pharmacy presents Painful Thoughts.
Oh, I'm sick. So I took my sick to the doctor. The doctor gave my sick a prescription. Now my sick and I are in line at the pharmacy, mingling with all the other sicks, on its way to becoming an even worse sick.
Next time, keep your sick at home and let Amazon Pharmacy deliver your meds right to your door. Amazon Pharmacy. Healthcare just got less painful.
And now back to my conversation with Dr. Aditi Joshi. I'm curious about how you're thinking about the telehealth capabilities that we'll have and how that will integrate into real life care. And how should we be thinking about that proactively so that we still have that connection with our healthcare team, but we still have the convenience and the increased access through all of these telehealth capabilities?
Connecting with our patients is a big tenet of being a physician. It's one of the things that makes it a real gift to be able to do this in life, right? So I'll say that we don't take it lightly, just thinking about how do you make sure that patients are connected and they feel as if this is a real encounter and they're really seeing their doctor and their healthcare team. The real solution is that telehealth is not for everything. We really need to implement it in a hybrid manner so that a patient says, oh, okay, well, I have a telehealth appointment this week because this is what I need it for. I don't need to go see my doctor this week. Great. I'm just going to see them on video, or I just have a question. I'm going to reach out. Something that makes it natural for them. And so when they actually go to the doctor, it's almost like they should feel like, oh, good, I get to see my doctor in person this time because, I just need to check in, or I need this exam or this procedure or whatever it is that needs to happen. I feel like it would make it a little bit more connected, actually, because it's different. It's not just the same thing. You're not waiting in the office. It's a bit less stressful.
So following up on that, you give lectures to patients about how best to use telemedicine and best practices. So walk us through some examples of best practices, how to get started, and how to make sure that the quality of care that you're getting is optimal.
Firstly, there's a lot of companies out there, so it's hard to choose. And so I can understand as a patient, it's very difficult to figure out, okay, where's the right doctor? Who's the right person for me? But I'll say this. So I would start first, whatever primary care physician you already have or are signing up with, see if they offer telehealth. Now, if they don't, because not everybody does, see if somebody in your community or a hospital system that you know of offers telemedicine. That's the first thing I would try, because at least it's in your community. And if it's your doctor especially, you can keep continuing and creating this hybrid care. Now, of course, if that's not available, and let's say you're traveling or you're somewhere and you just need a question or you need a medication refill or something that's maybe acute care, for example, I would probably look and see which companies are doing or have been around the longest, right? So some of them have been around a lot longer. So you can at least know that they have had their clinical protocols in place. Not to say that newer ones are not effective, but you want to make sure that it is all encompassing. And then lastly, it's actually going to deliver the care that you need. So as telemedicine has grown out, there are companies that are very specific. So I gave an example earlier now. There's companies that just treat mental health. There are ones that treat just obesity medicine. Some might be for men's health, women's health. So definitely when you're going, make sure you're in the right place. And then 2, when you get on the visit, make sure that they're asking you the questions your doctor would normally ask you. What's your past medical history? What's your surgical history? How did you get here? What medications have you tried already? And if it seems like they're not asking you those questions, definitely find somebody else, because you want to make sure that it feels like a medical encounter that you've had. And so then going into what is best practices for patients. So firstly, make sure that you have all the information that you need. your date of birth, your insurance, if they're taking insurance, inputting that, all the medications that you take, all the necessary things that you're going to need to have a medical encounter the way that you would signing off on the papers at the doctor's office. 2, make sure that your tech works so that the speakers are on, that you're in a place that people can hear you, that you can see it, check your camera, all of those things. I have a lot of patients who might be older. People ask me this all the time. What if someone is, in their 90s? What do you do? Well, they can ask a family member or a neighbor. And I will tell you, I have had a patient in their 92 figure out himself, call me up and do it. So you just never know. The point is that it can be for anybody. And then make sure you're somewhere secure. That's the third thing I would say. I've had patients call when they were driving, when they were in a busy restaurant. You got to remember, this is a doctor appointment. So you want to make sure you're somewhere secure, quiet, and in somewhere that you can have a medical encounter. And also then I would make sure that it's somewhere that you can maybe be able to have an exam so you can move around a little bit. So if your doctor needs you to move or anything, you feel comfortable doing that. So you can lie down or have them look at your back, whatever it is that you're calling about, someplace that you have a little bit of flexibility. And then, when you're getting there, make sure you have all your questions there. Some people like to write it up, but get your questions answered. This is not a place you can walk back into the clinic if you forget something. So make sure all your questions are answered. And then make sure that all the things that you need to know are clear. Where you need to go. Do I need a medication? When do I follow up? Where do I follow up? With what level do I follow up? All the same things that you would ask your regular doctor. And then lastly, of course, make sure you sign out so that when you do need another visit, that you're not stuck in the same visit indefinitely, because sometimes that happens.
If you were to look into your crystal ball and think about adoption of all of these various telehealth modalities, how do you see this shifting us from our current model, reactive care, to more proactive care for people's health over the next 5 years?
I really think that we're going to see a lot more home-based healthcare. So we talked about RPM, but if we take that a step further, we're going to actually be able to see patients that might have been hospitalized for 24 hours, for example, and instead of having them have to be hospitalized, they're going to be able to use telehealth, remote monitoring, remote vital signs, and people coming to get lab work, and they're going to be able to do that from home. The idea is, when I think about what we're trying to go toward and what people are already starting to do, is if you consider that the hospital at the moment is not a place where anyone wants to go because it's not relaxing, and it's also overburdened. There's too many patients there. There are patients that need to be there, right? Especially if they're critical or they need surgery or something happens and they really need the care of a hospital. But not everybody needs to be there for that. So how do we best take care of that population so that they're not in a hospital where they don't want to be necessarily, but they can go home instead? And I see that's what we're going to do. We're going to have a lot more options for what that means at home, because we're going to keep building on just the basis of telehealth, on the basis of RPM, and we're going to start doing more of this hospital at home until we're really able to probably do even some minor procedures at home. Who knows? We're going to see that. I think the hospitals also are going to be really places where we only need to send the sickest patients, because we're going to be able to do so much more in the future at home.
That is a very exciting vision. So thank you for sharing that with us. Before we close, anything that I should have asked you that I didn't, that you'd like to share?
The one thing I'd just like to share with the patients in general is that, one, I know that we all did it during COVID, but not everybody has actually tried it or they like it. And I just want to encourage everyone to remember that this is not to force you to have to do health at home, but it's really to give you the option and a lot more control over your own health. Because in the end, it's about you and your interaction with your own body and health, and how do you want your healthcare to be. And telehealth is a great option for you to incorporate so that you have a lot more of that control.
Well, Aditi, thank you so much for your time. Really appreciate it. I know that this has been really helpful for me, and I hope helpful for all of those people listening.
Thank you, Neha. It was a real pleasure to be here.
Whether it's saving drive time between doctor appointments for everyone in the family, setting yourself and family members up for medication delivery through the mail, mobile app tracking, or taking the plunge with a wearable device to monitor your blood sugar or heart health. This is Dr. Neha Pathak reminding you that better information leads to better health. Thank you so much for listening to this special edition of the Health Discovered podcast. Please take a moment to follow, rate, and review our show on your favorite listening platform. And if you'd like to hear more about a particular topic in the future, please send an email to webmdpodcasts@webmd.net. Thanks, and see you next time.
Amazon One Medical presents Painful Thoughts.
I could catch anything sitting in this doctor's waiting room. Ugh, a kid just wiped his runny nose on my jacket. And the guy next to me, sitting in a pool of perspiration, insists on sharing my armrest. Ugh.
Next time, make an appointment with an Amazon One Medical provider. There's no waiting and no sweaty guy. Amazon One Medical. Healthcare just got less painful.